And this is being recorded, correct?
Correct.
Okay. Well, thank you for coming and attending this presentation. My name is Scott Simonza, and I'm a volunteer with the Massachusetts Senior Medicare Patrol Program, or SMP. And we talk to groups of seniors all over the state about how to look out for errors and fraud in Medicare and your healthcare billing in general. What we do is talk about a few things that you can do to prevent and also to detect any kinds of fraud and abuse in your healthcare billing. So if you flip to the next screen, Kelly.
Yep. Hold on. There we go.
Okay, this, yeah, that just said we are being recorded. And then in the next screen, just a little bit of what we're going to talk about. I'll just briefly discuss who we are, the Senior Medicare Patrol Program, and talk a little bit about fraud and abuse and errors and what's the difference in billing for healthcare. And then the main thing is the three things that we tell people to do are to protect, detect, and report. So those are the primary things that we talk about, and we'll get into that in detail. And in terms of detecting errors, we use a personal healthcare journal, and we'll talk about how to use that and what it is. And then also, we deal with cases, we open cases for people who call us and have problems or have questions or issues with their healthcare billing. And we'll talk about some of the common problems that we see, like telehealth issues, ambulances, observation status, and a couple of other things. Not necessarily fraud related, but a common cause of errors and frustration for Medicare beneficiaries. And then I'll talk about some other resources that you can use to help you if you need help. Senior Medicare Patrol Program is a national program created by Medicare about 20 years ago to help prevent and detect and report on healthcare fraud and errors. There's one of these in every state and every non-state possession of the US. And the purpose of our program is to reach, educate, and activate Medicare and also Medicaid or Mass Health beneficiaries and caregivers and partners on how to be an engaged healthcare consumer so you can help yourself and help your partners deal with issues that might come up. So the biggest issue that caused our program to start is that Medicare estimates that they lose anywhere between 6 and 10% of their claim total annually due to fraud and errors. Medicare has about $2 billion a day in claims, almost $2 billion. So that's about $700 billion in Medicare claims every year. And that's great because it means a lot of us are getting our healthcare paid for, or a lot of our healthcare paid for. And it's a bad thing because it means that with so much money out there in Medicare, criminals look for ways to get a little bit of that from themselves. So there are lots of scams out there that try to defraud Medicare. And they estimate that up to $60 billion a year is lost to fraud and errors in Medicare every year. That's a ton of money. So what we try to do is educate people on how to look out for that and keep that number down. So fraud is always intentional. It's criminal and intentional. Errors and abuse, on the other hand, are not necessarily intentional, but they're also significant factors in terms of money lost to Medicare. Abuse is really a term for recurring errors. So if there's let's say a hospital computer system that is always putting an incorrect code in, that is an error in somebody's record. If that happens once, that's an error. If it happens many times, that's considered compounding an error, also known as abuse. So errors and abuse are similar and unintentional. Fraud is intentional and criminal. Okay, the fraud comes in many ways. And if you just click into this, Kelly, there are several items. Services not rendered. So somebody bills you for a service that didn't happen. Drug diversion is medications that are billed to you, but the drugs aren't used by you. They're given to somebody else, like stolen or used for somebody else's purposes. Upcoding and unbundling are technical things where you are billed for a certain procedure or service, and the code or the procedure and service that you actually had was less expensive. So they bill for something that's more expensive, get more money out of Medicare, and that's fraudulent. False front offices would be a provider that's not really a legitimate provider, but markets to people and you think it is, and turns out not to be. They get people's Medicare numbers and they bill Medicare for things that are fraudulent. And identity theft, many of the scams that we see, like telephone scams and mail scams, are ways to get your Medicare number, and that's really stealing your healthcare identity. And also recently, COVID-19 related scams of many types have come in, like somebody soliciting a COVID test, telling you that'll be free, and then what's your Medicare number? And you give away your Medicare number and they bill you for whatever, or they bill Medicare for whatever they want to. Okay, next screen. Examples of errors, fraud, and abuse are, in some cases, somebody gets billed for something and it's not your service. It's, you get a bill for somebody else's healthcare. We sometimes get calls from people that did not go to a particular hospital or physician, but they got billed by that physician. And sometimes it's just they have the same name as somebody else, and that's just maybe an error, not necessarily fraud. Incorrect medications, lab tests, x-rays, just about any type of healthcare service can be done fraudulently or in error. In some cases, physicians have been found, like a cardiologist last year in the US was found to have implanted pacemakers in 2/3 of his patients and only 1/3 needed them. So that is a serious case of fraud, also putting people in danger that didn't have to be. And at the bottom of this, telehealth is a fairly new concern in healthcare. With the pandemic this year, there have been a lot more telehealth visits, like a Zoom call with your physician or a phone call. Those are fine if they're with your physician and they're getting billed to Medicare appropriately. But there are cases where you might be getting billed for a telehealth call, which either didn't happen or didn't occur the way somebody says it did. In a case recently that we've had, a woman gave away her Medicare number on the phone and got some braces in the mail, like a back brace that she didn't want. And the physician, who she didn't know, that ordered that brace also billed Medicare for a telehealth call that didn't happen. So there's a lot of moving parts in this that contribute to fraud. And this screen just shows types of durable medical equipment, things like braces, wheelchairs, oxygen, that sort of thing. And that's a big area of fraud, which I'll mention in a little bit. In one example that we dealt with a couple of years ago, that's a durable medical equipment issue, was this woman, Rita, who had a 10-year-old wheelchair, power wheelchair. Yes, Edward?
I need to excuse myself.
Oh, okay.
Thanks.
Okay,
Thanks,
thank you.
Yeah.
Rita had a 10-year-old power wheelchair, and she got solicited in the mail for a new one, which she didn't need, but she just needed a battery. She ended up getting a brand new wheelchair for $4,000, and it turned out to be too big. So she couldn't use it effectively in her apartment, and she ended up also falling out of it because it was too powerful and too fast, and she ended up getting injured because of that. So marketing of durable medical equipment is not always on the up and up, and can be a significant issue. In addition, that might have prevented her from getting a legitimate upgrade in the future because of this basically inadequate equipment that was given to her. So we helped her get that situation rectified because she called us with that problem. And okay, you can move to the next one. Home health care is another big area of fraud because a lot of people, senior citizens confined to home, are vulnerable to scammers. And sometimes somebody can get home care and it ends up being billed for more days than actually happened. That's probably the most common, or for services that were not rendered, or for up-coded services that were provided at one level and billed at a higher level. So home health care it's usually a good thing, but it's an area that is ripe for abuse. And our main message in terms of looking out for yourself, because there are so many scams out there, a lot of them are on the phone. And fortunately, with cell phones and answering methods now, you don't have to talk to people that you don't know. But sometimes you do, and people get calls and get talked into a lot of things. Unfortunately, sometimes they give up their healthcare information, like their Medicare number. And once you do that, then it's kind of like out there and can be used for purposes that have nothing to do with you necessarily, but can end up causing a lot of trouble. Before I get into what to do about that, I'm just going to do a real quick overview of Medicare. Medicare, as you probably know, has different parts. A, B, and D are the primary ones. And then Medicare C is also a name for a Medicare Advantage plan, which some people have, which replaces regular Medicare. So if you flip to the next screen, Medicare A is for primarily inpatient services. So if you go to a hospital or if you're in a rehab center, that sort of thing. Medicare B is for outpatient services like going to see your doctor or physical therapy or other services. Durable medical equipment like braces and wheelchairs and things like that, diabetic equipment, supplies are also covered by Part B of Medicare. Dropping down to Part D, that's drugs, prescription coverage. And then Part C is what, if you use a Medicare Advantage plan, which is what most of the ads on TV in the fall for open enrollment period are for Medicare Advantage plans. And those are from private insurers like Blue Cross or Fallon or somebody like that. And they replace Medicare. So you're working with the private insurer on a Medicare Advantage plan. And that usually covers what Part A and Part B normally would cover if you were on what we call original Medicare. Sometimes that's advantageous for people. Sometimes it limits the physicians you can see. They have to be in the network for the provider and that, or for the plan, health plan, and that may be good or bad depending on your point of view. And then they may be less expensive for some people. A Medigap plan at the bottom of this is another private health plan, but that is usually a supplement to regular Medicare. So if your Part B Medicare for physicians takes, Medicare pays 80% of that, then a Medigap plan, if you have it, usually covers the other 20%. If you need to know more about your Medicare coverage and if you have the right coverage, then we recommend you talk to a Shine counselor, which you probably have through Elder Services in Andover, somebody available that you can make an appointment with. Even during the pandemic, you can do that on remotely. So they can tell you what kind of coverages are available and what to do about it, what really fits you best. So now, how can you help? And these three things are the main message that we have, and they are protect, detect, and report. I'm going to talk a little bit about each one of those right now. So what do we want you to protect? Well, it's your healthcare identity. And if you're a Medicare beneficiary, then the main thing about your healthcare identity is your Medicare number. So it used to be your Social Security number, and a couple of years ago they changed that. So now it's a random bunch of letters and numbers. And that makes it a little more secure because it's not then the key to your financial identity also. But in terms of healthcare identity, it's still the key. And you want to protect that just as much as you would protect your Social Security number or any credit card, because you don't want people to have that information to be able to bill Medicare for something that you didn't want. We also don't recommend that you carry the card around with you unless you're going to a doctor or a healthcare provider for the first time, or if you need it for your pharmacy, that sort of thing. Once you've been to a hospital or a physician's office with that number, then they usually have it in their system, so it's not something you have to produce each time necessarily. Okay, and I'm going to talk about this a little more, but we provide people a healthcare journal, which I'm just flashing up here. That is a way to record your healthcare visits and any information that is pertinent to your healthcare. The reason we do that is to help you detect errors and detect any fraud or abuse that's happening in your name to your Medicare account. And go ahead to the next one, Kelly. That journal which has a lot of detail to it. Where you can put a lot of information in there. The main thing we want you to put in there is a record of what your visits for healthcare services are. And if you can go to the next question, the next slide. We provide those to individuals or senior centers, and Caroline at our office can send one of those to anybody. So if you're interested, that's her phone number and that's her email address. And for the senior center, we can send a bulk order of those for anybody who wants them. This is just an example of the Medicare summary notice, which is something you get every quarter usually. Some people get them monthly, some people get them just online, but usually they come quarterly in the mail. And they show a recap of any healthcare services that you've had dealing with Medicare over the last few months. If you can flip to the next page, it's a better picture of the detail of what the Medicare summary notice, or the MSN, contains. And that's usually the date of service, the provider, what was the treatment or procedure, was it approved or denied by Medicare, and then it shows what the provider charged, but more importantly, what Medicare approved, if Medicare covers it. And then if Medicare approves, in this case, this is an eye exam. It was approved at $107, and Medicare paid 80% of that, or 86 and change. And that means that you or your supplemental plan would be billed the 20% difference. So most people take a look at this Medicare summary notice and they say, okay, I don't have a whole lot to pay, and I'm either gonna have to pay my $21.59 or my other supplemental Medigap insurance will pay it. So I'm in the clear pretty much, and then they put that away. So if somebody looks at the Medicare summary notice at all, they're usually looking just at that, this is what you might be billed. So what our message to people is, take a closer look and compare it to notes that you take about where you've been and when. Because if you went to the doctor on a given date and this shows up on your Medicare summary notice, you find a different date and you know you weren't at the doctor on that date, then there might be an error, or there might even be fraud associated with that Medicare summary notice. And a lot of people don't pay enough attention to know that. And if you're not paying for it, because the end result on the Medicare summary notice is you don't know anything, then you might not do anything about it. But if you are looking for errors and fraud and abuse, and compare that to your record of your healthcare services, then you can do something about it, which is what we're trying to get people to be more engaged at doing. If you find an error, or if you see something that you think is incorrect and maybe didn't apply to you on your Medicare summary notice, the back or the last page of that form is an appeal form. So you can always appeal to Medicare any denied claim or any claim that has an error on it, that you think has an error on it. And at the bottom of this page, it says KEPRO. That's an organization called the Quality Improvement Organization for Medicare. You can appeal directly to them for a service that you either think didn't happen or didn't happen properly. if the quality of your care is in question, then KeyPro is the organization to get in touch with. And on the next page, it just shows you the page on the Medicare summary notice that has the instructions on how to appeal a claim. So if you get a Medicare summary notice and you see a denied claim and you want to appeal it, you use that back page of the Medicare summary notice to do that. And this tells you how to do it. And if you need help, you can contact us or contact Medicare for help in doing that. So that was, we talked about protecting your Medicare number. And we talked a little bit there about detecting errors or detecting fraud by comparing your Medicare summary notice to your personal healthcare journal and looking for discrepancies in either the date or the provider or what happened or the cost of whatever services were rendered. So if you have done that, you've done your best to protect your Medicare number, but then you've detected any errors, or you think you have, then the next third thing we have mentioned that you should do is report it. So protect, detect, and report. So what do we mean by report? We usually mean call somebody. And the first person we recommend that you call is your provider, whoever provided those services in the first place. Usually your physician's office, if that was a typical doctor office visit. If you went to physical therapy, it might be the hospital that provided the physical therapy. If you're a home health care recipient, then it would be whichever company is providing that home health care service, that sort of thing. So the provider or the source of the service is usually who can solve any issues with errors. If not, you can also call Medicare, because whatever is on your Medicare summary notice, they're going to know about, and you can talk that over with them. Also, you can give us a call, because a lot of people that are Medicare eligible don't feel comfortable with calling the provider or calling Medicare or knowing what questions to ask or understanding the detail, because Medicare and healthcare billing is very complicated, unfortunately. So it's normal to feel overwhelmed and to not know exactly how to go about looking to fix a problem. So that's why our number is there, and because we take questions from people who need help, and we can help you ask the right questions to investigate a problem that you think you might have. Also on the bottom there is the Attorney General's office. That's Maura Healy's office in Boston, and we work with them if we suspect actual fraud. And you can also call them directly if you suspect fraud, or you can call us. And a couple other places where you can report scams are the Elder Consumer Hotline or our own scam hotline, and the numbers are there. Some people don't want to report errors because they're not paying for it. And what we recommend is that if you see an error, even if it says you don't have to pay, we recommend that you contact somebody about it, because as taxpayers, we're all involved in trying to protect Medicare from being scammed. Some people don't want to bother the doctor. Feel free to bother the doctor. You're talking to the doctor's office. Sometimes the doctor or whoever provided the service is not aware that there might be an error there, and they would certainly be interested in getting that fixed up. But if you're confused on what to ask, that's why we ask you to give us a call and we can help you, because sometimes these documents, the MSN, which is the Medicare Summary Notice, or the EOB, which is called an Explanation of Benefits. That's what you get from your private health insurance like Blue Cross. But they're similar documents. They might be confusing, and you can give us a call to understand them better or express that you might have a problem. Okay, next slide. There's a few things that I mentioned that are not necessarily fraud or abuse, but things that we would like you to know about in case you don't already. And that's because we do get calls from people who have issues and problems, and these are things that we see more often than not. One is there's a law in Massachusetts called the CARE Act from a few years ago that requires healthcare providers like hospitals to educate and train a caregiver or a healthcare proxy that you are using to help you in your healthcare. When you leave the hospital and go home or go to rehab, if there is something that requires aftercare, whether it's just medication or some kind of therapy, and the hospital is required through the CARE Act to provide information and training for somebody that's going to be providing that care for you. So you can request that if you don't see that coming automatically by the hospital, they are required to do that. And another thing that we recommend that you at least be aware of is that let's say you go to the ER with an emergency and they're trying to figure out your symptoms and whether to keep you in the hospital or send you home. You might be kept in what's called observation status for some time. They might put you in a room so you think you're an inpatient, but your status technically might still be observation. That is something that the hospital is required to let you know about. There's a form called the MOON form, the Medicare Outpatient Observation Notice, that they are required to give you if you've been in observation status for 24 hours because they want you to know that. And the reason we want you to know that is there is a rule in Medicare where if you have to go to rehab after a hospitalization, you have to have been an inpatient in the hospital for 3 days or 72 hours. And it's called the 72-hour rule. And if you weren't a qualifying inpatient for 72 hours and then you went to rehab, then Medicare would not be covering that rehab stay. And that would be on you, which can be a tremendous financial burden. And if you didn't know about it and you weren't expecting it, that is a real bad surprise to get somewhere down the line. So that's why the hospital is now required to give you notification of your status. So if you're in outpatient observation status, then you want to ask them why. There may be legitimate medical reasons for that, but you want to know why. And another area that we get a ton of calls on is transport. So ambulance transport, whether it's from home to a hospital or from a hospital to a rehab center or one place to another, people don't really understand the billing for ambulances. And the key in ambulance billing is if it's medically necessary and you can't be transported any other way, then Medicare will cover it. But that can be a gray area sometimes, and you might assume something is covered and it's not. And the reason that it's a problem is that even if it's a short trip, it usually can be billed at a very high amount. And I'm talking thousands of dollars for a quick trip to a hospital, or from a hospital to a nearby rehab center. And if it's not medically necessary and you didn't understand that, or if it wasn't indicated to you, then that can be a big problem after the fact. And if you go in a wheelchair van and not an ambulance, that's almost never covered by Medicare, and except under certain specific conditions. So a lot of people think, oh, I'm going in a wheelchair van, that's going to be covered by Medicare, and usually it's not. So ambulance and chair car service is a real issue in healthcare billing, and a lot of people don't understand it. So the main message that we have there is, don't assume things are covered unless you know for sure, and ask. And to that same point, if Medicare isn't covering it, then your secondary insurance isn't going to cover it either. So it's good to know upfront, especially in a non-emergency situation where there might not be coverage. Another thing that is good to know about, hopefully you don't have to deal with them, are objects that are events that are called in the healthcare business never events. They shouldn't happen. And it's really things that are clinical errors, or errors usually at the hospital, or it could be at a long-term care facility or rehab center, like falls and injuries from being treated. So you should never have to pay for something like this. Hopefully they would never happen, but if they happen to you and you're unfortunate enough to have to deal with that kind of thing, you still shouldn't have to pay for them, because they should be on the hospital or the treatment center, and not billed to you. So it's just another thing to know about, because when that kind of thing gets billed for erroneously, even if you get it overturned eventually, sometimes it can take a lot of time and effort and aggravation to get out of that situation. So one other thing that we wanted to mention is scams are happening all the time. A couple of years ago, there was a big increase in brace scams, where these kind of criminal networks would be set up, where a call center would be calling out to Medicare beneficiaries saying, do a survey for us on pain. And so you'd say, yeah, that's okay, I will. And they say, do you have pain? And you say, yes. And where's your pain? And you say, I have pain in my knee or my back. And then they ask for your Medicare number. And most people know that you should never give your Medicare number over the phone to anybody. Certainly not to somebody that you don't know. But we probably got 50 calls 2 years ago in early 2019 in our office about brace scams like that. And out of those 50 calls, I would say a dozen people actually gave up their Medicare number. And when that happened, they all got braces in the mail because they had said, oh, I have pain in my back or whatever. And then we had to help them return the braces and also get credit for the braces. And it was a big problem. And that particular scam was busted in April of 2019 by the FBI, working with a bunch of different states who were involved in this scam. And they arrested about 25 people involved in the call center and that sort of thing. And they estimated that there were $1.2 billion in fraudulent claims over a year in in that scam. That's a huge deal. And then we didn't see those calls for a while. And then this summer, around this summer of 2020, we started seeing those calls bubble up again. And now we see quite a few. So exactly the same type of scam, and it's probably different people because the other ones are still in jail or wherever. But the very similar scam in braces is happening now on the phone. So if you get a call about taking a survey for Medicare or doing having pain, my recommendation is that you hang up. But if you notice here, there are other scams that have come up fairly recently. That's the census, which was last summer for the most part. People would come around, that has nothing to do with healthcare, but it's a very similar scam. People looking for your information, and if you give it up, then they could use it fraudulently. And since COVID-19 came around last year, there have been a number of scams, usually involving testing, maybe also involving vaccines, even though vaccines are free for everybody in the US. But if you get solicited for coronavirus testing or for any of that, any services related to COVID-19, and you don't know who they are, then our recommendation is to do what we always tell people, which is hang up and let somebody know. Genetic testing is another thing that's also indicated on this slide, where that became pretty common last year, where people would set up either a booth in a health fair about genetic testing or send you some, do a cheek swab and send it to us for a free genetic test. That's okay if it's your provider, your doctor asking you to do that, but if it's somebody you don't know, we recommend avoiding that because usually they are scams. And I mentioned telehealth earlier, or telemedicine, and that's become really popular with the pandemic because a lot of people aren't going physically to the doctor's office if you don't have to. And that's a great kind of service if it works, if it's with your provider, and it's, if it's something that you can do in a useful and productive manner with your provider. But you don't want to get involved with it if it's not your provider, like your doctor or your, somebody that you're consulting with. So you just want to be careful about that, because telehealth is easy for people to bill if they have your Medicare number, but you want it to be from your own provider who's supposed to have your Medicare number, not from somebody who has maybe tried to trick you into a telehealth visit, or even just tried to trick you into giving up your Medicare number so they can bill for a telehealth visit or any other kind of fraudulent service that they have in mind. So the main thing is to do what we told you earlier, which is protect that healthcare identity, detect any errors, and report to somebody like us or like Medicare or your provider if you think you've been subject to fraud or abuse or errors. One other quick thing, especially when I was talking about ambulances, but this could relate to other items as well, is a thing called the ABN, or the Advanced Beneficiary Notice. If the service you are getting, if the provider of that service thinks that it may not be covered by Medicare, they might ask you to sign that notice. And that means if you've signed that, that means you're, liable to get charged. And if it's a service you need, then maybe that's legitimate. But in a lot of cases, you might not know if you're being covered or not. So that's what that notice is. A lot of people never see those. When you're getting non-emergency ambulance service or chair car service, the provider of that service should be giving you that notice if they think this is not going to be covered. So that's just something to be aware of. You can always appeal it if you get charged for a service you didn't think you were going to be charged for. But that's just another thing to know about, and we do get calls about those things. So just as a recap, we said protect, which means don't carry your Medicare card if you don't need to, and don't provide your Medicare number to anybody who you don't think should get it. So that's protecting. Then we asked you to detect any errors or fraud by keeping a record of all your medical events in a journal, such as the personal healthcare journal that we can provide to you, or something similar that you use that you're comfortable with and you know how to find. And comparing that to your Medicare summary notice from Medicare and your explanation of benefits from any other private insurances that you have. And then do the third thing, if you detect any errors or fraud, or just you have questions, which is report. Talk to somebody, call somebody, and take action if you suspect errors, fraud, or abuse. And you can call your provider, you can call Medicare, you can call us, and we'd be happy to work with you. Again, we don't think you should pay a particular bill unless you have compared that claim to your healthcare journal. And that's that whole detecting piece that we talked about. And if something doesn't feel right, it probably isn't. So trust your gut and give us a call if you suspect any issues. And just to finally, it's up to all of us. That's why we talk to people, because a lot of people are not aware of the kinds of issues that you can run into or what to do about them. And that's why we give you our number on our personal healthcare journal. Our phone number is on the front and the back of it and on the inside as well. And we are always welcoming calls from people who think they have problems. So thank you. Appreciate your attention today. And Kelly, thanks very much for inviting us. And let us know if you need any healthcare journals or if you just need any follow-up from us.
Thank you so much, Scott. It was good to have you. I think the last slide is for questions.
Yeah.
Joan, do you have any questions? I can see, I think you're muted.
Kelly?
There you are.
I have a couple of questions. A few years ago, I fell up in the senior center. I did not want an ambulance because I knew I was not hurt that badly. You know, I just had to get up. The ambulance, the person, one of the staff members insisted on calling the ambulance, which I was not getting into. So, you know, but I got charged. And it was quite a bit of money. And after long discussions, the town did pick it up. So I think the staff has to be a little careful about calling ambulances if somebody is not getting into it or they're not really seriously hurt. I don't think the staff should be able to make the judgment. That's, you know, I'm not saying this is up to you, but it just goes along with what he was saying about, and I did sign one of those forms saying, because they kept putting this form in front of me to sign and I didn't read it and I signed it. So
The
that
ABN
was one
form.
thing.
Yeah. We've seen that happen also when somebody falls in the front of their house and the neighbor calls an ambulance and the ambulance comes and the person says, I'm not going, but then they get billed, not the neighbor. So that's a similar situation. It's a tough call because, you know, if somebody's worried about your safety, so that's important in case you do need it. But then if you don't use it, then you might get billed just like you did, Joan. And it was good that the town did pick it up because in a lot of cases, then they would.
Well, we have a good town. The other thing I wanted to ask you, you mentioned not carrying our health, Medicare cards with us.
Yeah.
I was always told to keep all those cards with me in case I got sick, that I would have this information on me.
Yeah, that's a judgment call that you can make. We never recommend, we always recommend that you don't, just because you lose your wallet or something and somebody can then take it and use that information. So that's a liability there. Usually if you don't have it and you get hurt, chances are for most people, they're going to go to a hospital that already has their information on file, or they're going to go to their doctor who also has that information. And so after the fact, even if you went to a hospital like you were not in your own town, and then you had to go to the ER, they're going to get what they need eventually. So the fact that you don't have your card there is not necessarily a problem.
They're not going to turn you away.
No, they
All
can't
right.
by law. Yeah. So some people carry them around. We just don't recommend that you do because of the potential for somebody to steal it.
Well, your talk was great because there are many things I heard today that I didn't know, like the CARE Act, which I think is important. So I learned quite a bit. I hope we get a paper with all these numbers on it. I kept trying to write these telephone numbers down. Didn't succeed with all of them, but it was great.
Well, get one of these from either Caroline or Kelly. I think if you talk to Caroline, you can get a bunch of these.
I
did
took
get a
her
lot of
number and
them.
I put.
All those numbers are in here, like on the
All right,
first couple of
thank you.
pages. Well, thank you, Joan, for coming. Really appreciate it.
It was great. I really appreciated it.
Okay.
Thank you both for being here. I will send the recording to both of you, and I will send it out to everyone else as well. But thank you so much, Scott. It was a really great presentation.
Thanks, Kelly. And feel free to get in touch if people see this and have questions about any part of it. With
Will
either
do.
Caroline or me. Yeah.
Kelly,
Okay.
are you getting those books that he suggested?
We got a lot of them during the last call, which was a few months ago. Let me see if there's any of them left. If there is, I'll let you know. If there's not, I will let Caroline know to get more.
All right, thank you very much. And thank
Bye,
you for
thank
this.